Hey guys, I wanted to come on here and provide some educational insight to your news feed for those of you who might be interested during this downtime. And also, to be honest, I wanted to create an outlet so that my brain doesn't go stir crazy while my business is on hold here for a little while. So I'm going to spend the next few minutes talking to y'all about my favorite joint in the body, the SI joint, or the sacroiliac joint. The SI joint acts as the foundation for your spine. Or rather, if we're being technical, the pelvis is the foundation and the joint keeps the foundation in order. Either way, a prominent mechanical component to the body, as you can imagine. The SI joint is formed by the connection between the iliac or hip bones and your sacrum. So because of its whereabouts in the body, it mimics a shock absorber, dissipating ground reaction forces before they have the chance to impact the spine or the spinal cord. So a pretty remarkable focal point. Also pretty remarkable is that humans are the only species, we're the only species on the planet with a movable, this pelvis isn't moving, SI joint, which means that our joint needs to maintain a certain amount of quality mobility in order to do its job to protect and support our spine, our framework, our person. In saying that, when the SI joint senses that there's any kind of structural implication happening in the body, be it an imbalance, a misalignment, a disc issue, kyphotic posture presentation, a subluxation, what have you, the joint is going to do its job and it's going to protect. Okay, so we're good for a little while, but then the joint resides in protective mode for an extended period of time because the issue is not being corrected, right? So then the joint gets overworked, it becomes rigid, it becomes locked up, for lack of a better description. It moves toward immobility or lack of movement rather than mobility. So then what happens? So the joint says, okay, well, she still wants me to get up every day and put one foot in front of the other. She still wants me to bend down and stand up and sit and so on and so forth. So I'm going to need some help here. So the SI joint recruits its surrounding neighbors, the tissues that surround the joint. We're talking your big powerhouse muscles, your posterior or back postural muscles, glute medius, glute minimus, glute max, piriformis. So those muscles, they say, okay, we've got it. We'll make up for the lack of movement in the joint so we can continue to put one foot in front of the other. And they're working overtime. Things are good for a little while. You're still able to do what you need to do because the body is amazing like that and it's always adapting. You're good until you're not, because again, we're not addressing the core issue, right? So then the muscles say, man, I don't know if I can do this anymore. I'm not used to exerting this much effort for this long, this hard, so I'm tired now. The muscles get irritated, they become hypertonic, they reside in a chronically shortened state. And that is typically the point when you will hear someone say they have low back pain, or their back feels so stiff when they sit for too long. Things are not looking good. And I could keep going to bore you some more. I mean, we could just keep going down. The muscles need recruitment, so then the hips start hurting, so then the knees start hurting, and then you have foot and ankle issues. In other words, my point is, it's constantly, when there's an issue in the body, a continuous physiological compensative chain of events. Because, like I tell all of my patients, the body is always trying to maintain a state of homeostasis or a state of complete and serene balance. And in order to do that, it's got to compensate. So I always say it's the thought that counts, right? The body's got a nice thought, but in trying to maintain homeostasis, when there's issues, structural implications present, things get out of whack. So all of that to say, the sacroiliac joint never goes unassessed in any of my cases. In fact, it's usually the top 3 things that I address or that I evaluate in new patient cases because it is more likely than not very involved in their pain pattern. So I'd like to end this extremely boring monologue by providing or demonstrating a really simple exercise, really easy, to encourage SI joint mobility, because I know a lot of our schedules are different right now. Maybe some of you are sitting a lot more than you're used to, or you're moving a lot more than you're used to, chasing after your crazy children. So I want to help you out. Maybe you're in new pain now, maybe you feel stiff, maybe you feel rigid, maybe you've had pain for a long time. Regardless, hopefully you understand now after listening to me talk that the SI joint is more likely than not always involved. So correcting it and encouraging SI joint mobility is always a really, really great thing. Not only for physical pain, but also proper SI joint movement or mobility encourages really good digestion because as I always say, no one system in the body works alone. So let's go figure out how to get your SI joints moving. Okay, so here we go. We're in the big room. I'm still really new at all of this, so thanks for hanging on if you still are. I'm going to try to show you now how to perform an SI joint mobilization, an exercise to encourage SI joint mobility. Are y'all tired of hearing that phrase? On your own at home. So really wonderful to encourage SI joint movement via this mobilization for all systems of the body, especially for those of you who are in pain or feel like you're chronically tight. So I'll do both sides and try to explain as I go. First off, what we're going to start doing is knees bent, palms up, place one hand on the belly. Let's take a few diaphragmatic breaths, meaning you inhale and exhale through the nose. On the inhale, the belly rises. Let's get that diaphragm pumping before you exercise. It's something I always encourage because diaphragmatic breathing encourages length, tension of your spine. So a few diaphragmatic breaths. Belly rises upon inhalation, falls back to normal positioning on exhalation. All right, so the SI joint mobilization, I'll show you both sides. Probably best to do without your shoes on. You're going to push through your heel and slowly rock the pelvis away from you, keeping foot flat on the ground. And come back. Slow, palms are still facing up to encourage openness of the thoracic spine. You're always thinking about every part of the body, no matter what exercise you're doing. So I'm pushing through the heel and I'm rocking my hips. My knee is trying to stay as straight as it can. In other words, it's not coming over with the hips. It's pushing through the heel, a little bit of separation between the knee and the hip. You can do 5 to 10 nice and slow on each side. Told y'all it's really simple, really easy. So the other side looks like this. I'm pushing through the heel, I'm rocking the hips over, and I'm coming back. And I'm pushing. You already practiced your breaths, so you don't have to think about how you're breathing. Just make sure you're not holding your breath. Nice and slow, 5 to 10 on each side. When you finish with that, I encourage you to bring your knee towards your armpit and hold that stretch. Deep belly breaths for about 20 seconds on each side. It's still part of the mobilization here. When you finish that, you're going to come back to starting point and very slowly, one time, just push through the heels and drive the hips up and slowly lower them down. That sort of sets the mobilization in place. And that's it. So we have your, let's see, pelvic rocks. 5 to 10 on each side. We have your good stretch, 20 seconds per side, and then we have your setting standard. Cool. If any of you are watching, I hope you enjoyed it.